Good afternoon, friends. I'm Dr. Ankesh Sahetya. I'm a gynecologist in Andheri West, Mumbai. Today's topic we're discussing is a very common one, mostly seen in summer months, mostly seen all throughout the year in our country, since India has two weathers, warm and warmer. The topic which is very commonly seen is vaginal infection, very commonly referred to as yeast infection by many of the younger girls. Usually, a girl is sexually active newly sexually active in her younger teens or her early 20s, she comes with the complaints of severe vaginal itching, internal and external itching, and with complaints of some sort of a discharge. She describes it as mucoid discharge or a white curdy discharge or even a whitish grayish discharge. The symptoms vary from just vaginal itching, vaginal burning, things like she feels like a sensation of pain in the vagina during intercourse or just generally like that. Very commonly, this is associated with a mild burning in urine called as a UTI. If you see the previous video of UTI, you'll get the symptoms and the treatment in that. So, what is to be done over here? Ideally, visit a professional, visit a gynecologist. A simple internal speculum examination with a Cusco speculum is done. Looking at the texture of the vagina, looking at the walls of the vagina, if they are inflamed, reddened, the kind of discharge, the color of the discharge, is it white, is it thick mucoid, is it curdy white? Very often, even a pap smear is advised with the cervical tissue to rule out any form of severe infection or any form of cervical changes. But besides that, the basic treatment is to treat the cause, treat the symptom. The three commonly seen conditions are: first one is candidiasis or the vaginal yeast infection because of fungi. It's classical fungal infection. It causes vaginal and vulval candidiasis, primarily itching with some inflammation and thick curdy white discharge. The second one is bacterial vaginosis, or commonly referred to as BV, which indicates there's a change in the flora and the fauna of the vagina, indicating a deficiency of lactobacillus, which is the good bacteria seen in the vagina and the gut. The third one, seen not so commonly, also called as trichomoniasis, which is a parasitic infection which happens due to sexual transmission, sexual activity. Now, all these conditions are also exaggerated in conditions of heat and moisture and darkness. The vagina, being a blind pouch, doesn't receive any sunlight, hence, it is also going to receive less sunlight, it is dark. Secondly, the moisture and the heat which is present more in sexually active girls who wear clothes to work out, which are non cotton, materials like lycra, materials like silk, which cause excessive sweating and excessive moisture, those exaggerate such conditions. All conditions are easily curable. Some require partner treatment, some require treatment for long term of the patient itself, and some regular follow ups. After that, no recurrent is seen. Recurrent infections of any of these causes, especially candidiasis, could indicate some form of high blood sugar or diabetes history. Even they are exaggerated in that, and even diabetes can be treated depending on the patient's blood test and family history. There's no need to worry about these conditions, but yes, the itching can be exaggerated and can be quite troublesome for some of these girls. So, in my advice is, instead of home remedies, please visit a gynecologist, get diagnosed, and get treated. That's all you need to know about simple vaginal infections in adolescent girls. Thank you.